Hello and welcome to The Vaccine. I'm Jeremy Fernandez. For much of the pandemic, Western Australia has been isolated and lived relatively COVID-free, while much of the East Coast and the world slowly transitioned to living with the virus. WA clung on to its zero COVID strategy. Now, for the first time in this pandemic, the state government there has outlined its plan to reopen the state to the outside.
The aim is to provide certainty for Western Australians, to provide certainty on how business and our unique way of life can continue safely once we further ease our controlled borders and minimise any impact the inevitable arrival of the virus may have on our state.
The border will open when 90% of over 12s are fully vaccinated. That's not expected to be reached until late January or early February. And Premier Mark McGowan isn't ruling out borders within WA to lock in areas with low vaccination rates. Let's bring in Casey Briggs now. Casey, how are those rates looking across WA?
Hi Jeremy. So statewide, the vaccination rate among 12 plus population at 62.3%, but there's a lot of variation across the state, particularly some of the more regional areas really flagging. These are all of the regions, or most of the regions, below average in Western Australia. And if we go to the bottom, you can see there are some real issues where there are some areas. So Kimberley, less than 50% of the 15 plus population are double vaxxed. The Goldfields, 45%, less than 30% across the Pilbara. So these are the regions that may well be, shut out from the rest of the state if those numbers don't flag. So that's one challenge, is getting these regional vaccination rates higher and quicker than Perth is currently tracking. And the other challenge will be making sure that first doses will continue to be offered, because we're seeing a real slide in the first dose rate at the moment. 5,679 first doses on Friday, and we're seeing the sort of downward trend there. Now, maybe there's a date now for COVID to be let into the community. That is a motivator for people to get the jab. We saw an increase in Queensland when they set a date and set a target to open up, but that too is sort of tapered off now. We're seeing a decline in first jab rates there. So that will be the other challenge in WA, is making sure that these numbers remain relatively healthy for at least a few more weeks.
And Casey, this week the world recorded 5 million COVID deaths.
That's right, Jeremy. We've watched the world now tick over 5 million on the official death toll of this pandemic. Of those 5 million, well, about 15% of them in the United States, about 12% in Brazil, just under 10% in India. But as we've talked about many times in the last 2 years, this is quite literally less than half the story, because these are the deaths that we actually know about. Latin America is one example of a region that was very badly hit through this entire pandemic. Here are the deaths in Peru going back to the beginning of the pandemic. But the issue in Peru is, in a country that has really had a very limited and stretched health system, a lot of deaths have been missed. Let me show you the deaths again in another view. These are the cumulative number of deaths going back to the beginning of the pandemic. So we're at more than 170,000 of those at this point. Now, what I want to show you is the total cumulative number of people who have died in Peru over and above what you would normally expect to die in an ordinary year. We call these the excess deaths, and they're considerably higher than the official death toll. So this is a much more accurate, frankly, measure of the real toll of this pandemic. And that's a common pattern that we've seen all around the world, really. There was an economist done by data scientists at The Economist, and they reckoned that really the official count of 5 million deaths, probably an underestimate by perhaps a third. Perhaps the real number is more than triple the 5 million that we've seen. And Jeremy, just in case you were worried and viewers were thinking maybe this pandemic is moving behind us, well, no, unfortunately not. The numbers of people dying are still very high, upwards of 7,000 or 8,000 people dying a day at the moment. Still, in November 2021, we're seeing now, as Europe goes into winter, it's recording again an increase in deaths and an increased share of the world's deaths. And I'll just pick out a couple of countries to show you, because the hardest affected ones there are some of the regions with the lowest vaccination rates. First, Romania, which is recording record deaths at the moment, and one other country, Bulgaria, again seeing a big spike in deaths right now. And those two countries, Jeremy, happen to be two of the countries with the lowest vaccination coverage across all of Europe.
Casey, thank you. It's been nearly 2 years since this crisis began in Wuhan, China, and we still know little about the origins of COVID-19. So it's something of a scientific miracle that despite that, vaccines are being rolled out across the world. Those who are inoculated can in part thank Professor Edward Holmes. Early in the pandemic, he publicly released the genomic sequence of the virus that allowed tests and vaccines to be developed. Now, this week, he won the prestigious Prime Minister's Prize for Science. Professor Holmes joins us now. Professor, congratulations and welcome to the program.
Thank you very much.
At what point did you come to realise that this information you were sitting on was going to be really critical in the next few years and the months?
So when we released the data back in January 2020, I knew at that point it would be very important for COVID tests. That was kind of obvious that if you had the sequence, you could make the test we all have used today. Its use as a vaccine, as the blueprint of the vaccine, didn't really become clear to me for a little bit later on, maybe some weeks or months afterwards. I think one of the great achievements of the pandemic era has been the amazing speed at which these vaccines have been developed, particularly the mRNA vaccines. It's just been stunning. So, it didn't really dawn on me at the time quite how rapid that vaccine development was been, but it has been one of the great success stories of this outbreak so far.
You weren't the first person to sequence the genome. Why did it take so long to get out?
I wasn't the first person to sequence it. My colleagues in China were one of the early teams. There are actually a variety of groups working on it. So you need to remember, when you have these early outbreaks, there's always a bit of a fog of information at what's happening. It's not quite clear. There's always some uncertainty. It wasn't quite clear how many cases there were at the start. I mean, it did actually grow pretty slowly at the start. Also in China, the authorities there are quite clever. They're quite concerned about controlling the message, what people hear about. And so there's a lot of kind of uncertainty and just being care what was said. And that I don't think it delayed things that much, but it's kind of just meant the information kind of trickled out quite slowly at the start.
There is that lab leak theory that still floats around and gets varying degrees of attention. You're still a proponent of the theory that it came from the market. Why is that?
Yeah, and the lab idea is really based on a coincidence, and the coincidence is the fact that the virus was first detected in Wuhan, that contains a very large virus lab, and that's basically the evidence. My feeling for why it's natural is because we've just seen so many of these emergent events. They happen all the time, and this one has all the signatures of those sort of natural events. In particular, if people remember back to SARS-1, the one that was in southern China in 2002, 2003, that kind of spread to a few countries, that was associated with an animal market. Okay, first case is really animal market. And the same things happened here. It's the first case is associated with an animal market in Wuhan. I think that's the most likely situation. The lab escape idea, many people have looked at. The US intelligence agencies released the declassified report a few days ago, and basically they have found no evidence linking the lab to the outbreak. Okay, so the theory is still on the table. It's not disproven, but after 20 months of staring at data and looking for evidence, they found none. And I actually don't think there's any evidence to find. So what I really hope is that the politics of this kind of just fades away. We can get back into the science. WHO have now got a new team to go out there and investigate. They should be allowed to do that in an unfettered way. And hopefully we'll then find out exactly where it came from. And we need to know, because until we know where this one comes from, we can't really use our best efforts to predict the next one.
Knowing what you know about virus evolution, where are we headed? More variants, more immunity, more pandemics in the future, or a mix of all three?
My prediction has not been very good on this, so you need to keep that in mind when you hear my answer. I do think, though, it's an absolute certainty that when the virus is going to be around for basically forever, I suspect, it's going to evolve, absolutely. And I expect it will evolve around the immunity we have. It will evolve around the vaccine, and I think that's very predictable, but nothing particularly to overly worry about. So we'll get new strains, we'll get new variants. Those variants will be better able to evade our immune response, and therefore they'll need to update the vaccines. And at the moment, if you listen to the big biotech companies like Pfizer, they're predicting that they can get designing a new vaccine strain. It's actually pretty simple. So designing a new strain, once they see a new variant, to getting up an improved vaccine in 100 days, right? Which is quick, so 4 months or so. Hopefully, as we get better at doing this, that time will be reduced from 100 days to, almost just a few days. So I'm optimistic that, given the reality the virus will evolve, I'm optimistic now that we have the toolkit ready to be able to redesign our vaccines and just kind of keep the virus at bay and get on with life as best we can.
Professor Holmes, it's so good to talk to you. Thank you.
My pleasure.
Now, Professor Julie Leask is a public health expert who specialises in immunisation research. She joins us now. Professor Leask, listening to Eddie Holmes a moment ago, it does seem that this whole vaccination drive has a long way to run, doesn't it?
It does indeed, Jeremy. We're now looking at third doses and boosters for people in certain countries where they're available. And we will need to keep making sure that our vaccination rates continue to increase, both in the countries where many people have not had a single dose, and also in, eventually with making sure that people are boosted when their immunity has waned.
Is the messaging early in a pandemic in this sort of circumstance different from the messaging around boosters and tackling those people who are still hesitant, still unvaccinated, for example, like those in Western Australia?
It is a little bit different compared to where we were at last year, for example. We're much more in a crisis mode. And in fact, ironically, I think we really are in quite an emergency right now. It doesn't feel like it, but there are communities with very low vaccination rates, as we've heard. And once COVID reaches those communities, there'll be a very significant disease burden. So it's absolutely urgent that we take the effort to get vaccination rates high amongst all regions of Australia, amongst all communities, particularly, as we've heard, Aboriginal and Torres Strait Islander communities and other communities where vaccination rates are lower.
So what does living with COVID look like in the next 12 months?
It's going to be an interesting time because I think we'll certainly have a lull in COVID cases compared with what we've had in New South Wales and Victoria over the next period. But then we are going to have outbreaks. And the outbreaks are going to look different because a lot of the people who get COVID will already be immune due to vaccination. But those who are not vaccinated will continue to be quite vulnerable to getting severe disease. So we're going to be having COVID around us. That's an inevitability. And then the states that are not used to having COVID outbreaks will also be dealing with them and ramping up their systems and getting used to them as well. We'll also have some tricky sort of ethical debates around how much control of COVID is sufficient and what we're prepared to put up with. The good news is we won't have anything like the lockdowns we've had so far, but we're going to be continuing to learn to find that balance between control and getting on with life, and also seeing that economic and social recovery along with attention to other areas of health that might have been missed out on.
And so how do we keep people, both the vaccinated and unvaccinated, doing what needs to be done?
Yeah, so we need to keep focusing on getting those high vaccination rates for first and second doses and then third doses or booster doses as well. We'll need to have in place ongoing testing, tracing, isolation. So people who have respiratory symptoms, they'll need to be tested. They'll need to stay away from others. And it's very important that we sustain those behaviours in particular. Otherwise, we won't get that good control of COVID, even with the high vaccination rates. We'll also need to have a smaller lockdown or caps on gatherings, and we'll see much more of the onus on organisations to control those outbreaks as well as we head into the future. So it's going to be a very interesting time because we're so used to not tolerating any COVID. And so, we minimise it, but accept that it's there is going to be an interesting and challenging time for us.
Professor Leask, thanks so much. And that is the show for this week. Thanks for your company. Bye for now.